Hi.
Hi.
Thank you for coming in today. So your name is Jackie, correct?
That's correct.
Wonderful. So Jackie, talk to me. How are you feeling? Oh, before I start there, you read your consent form that you signed at the beginning
Yes.
before you came in here, right? Okay. I just want to remind you that everything we talk about will be confidential, unless it is something that I'm required to report. So if you would need further explanation on those things, I can explain them to you.
I haven't abused any children, so you don't have to report.
Okay, wonderful. Wonderful. So how are you doing? What's going on?
Well, today was really great, but I just feel sad because my daughter went back, my older daughter.
Okay, so you have an older daughter, which indicates you have two or more daughters?
I have two beautiful ones.
Oh, that's good. That's nice.
Well, I'm lucky I have the younger one who comes and visits me often. But the older one doesn't come as often, and she's very lonely, and I feel very sad that I had to let her go back again.
Where does she doesn't live with you? Does she live far away?
Yeah, she lives in Arizona. She's there for pharmacy school. So
okay.
I'm happy because she likes her school and everything. But I really miss her a lot of the times.
Yeah.
And on top of it, today I was a little down because chemo is not so much fun.
Right. So you're going through chemotherapy. That must be really hard.
Yeah. Well, in the beginning it was harder. But now, with the help of my children, my husband, all my loved ones, the support system is so great that I feel much better than I did in the beginning. It's just that the physical side effects are not a lot of fun. They're very draining.
Right. Right. I can imagine. So you have a really good support system.
Yes.
So that's wonderful.
Yes. Yes.
So could you walk me through maybe what it is that you're dealing with your chemotherapy when you were diagnosed? How long is your treatment?
Well, I was diagnosed on October 18, 2012.
Okay.
After, very accidentally,
Okay.
after having a colonoscopy, thanks to my younger daughter.
Oh, wow. Okay.
She's the one who pushed me into having the colonoscopy.
That's
I
wonderful.
didn't have any side effects. Yeah, she's my angel. And after I found out, well, when I found out I was in the hospital, I think the video went off.
No, it's still recording. We're okay. Okay.
I was in the hospital and I had to stay there for several days because I had a tear in my colon due to the colonoscopy.
A tear in your colon?
Yeah.
Okay.
Which caused a bad infection, so I was hospitalized for several days. But while I was hospitalized, the second day I found out. Yeah. I found out that I had cancer. And first
shock.
it was a big shock. Yeah.
I can
shock
imagine.
for me, for my family.
Hold on.
So after I came home, I had to basically wait until my the tear in my colon was healed fully.
Okay, right.
And then I had to have surgery. So they waited for a month until the inflammation is totally gone, and then I had surgery.
Okay.
And then I had to wait another month before I could have chemotherapy.
Wow, so that was a long process.
Yeah, I was hoping that I didn't have to do chemo, but after they did the surgery, that's when I found out that I was diagnosed as stage 3.
Oh, wow. I'm so sorry.
Yeah.
Wow.
Yeah, it's very hard, not unless people have gone through it. It's hard for people to understand.
Like many other chronic illnesses. Yeah. So how do you feel about your treatment and how it's going? Do you feel like
Well, thank God I have very good doctors.
Mhm.
The clinic I go to is close to my house.
Mhm.
Thank God my husband can take off on the day that I get the chemo. It's every
Oh, that's nice. So
two
he's able
weeks.
to
Yeah.
take you to your treatment sessions
Yeah,
and be with you and by your side.
exactly. And my
Mhm.
younger daughter comes home the second day and she's able to take me back
Okay.
to the clinic to take the pump off because I have a 48-hour pump.
Okay. So your second daughter doesn't live at home either, I gather.
No, she doesn't.
Okay.
She doesn't. I wish she did.
What is she doing?
She is a very, very smart girl. She's studying.
Mhm.
She's becoming a clinical psychologist.
Oh,
She's
that's
working on her
wonderful.
PsyD.
That's
So she's
wonderful.
going to be like you.
Wonderful. So you have two daughters who seem to be very educated, that they're going to school and taking
Yes,
care of
yes,
themselves.
yes.
So can you talk to me a little bit about how your relationship is with your daughters? Do you feel like you're getting the support that you'd want from
Oh,
them?
absolutely. When they're with me, they're like butterflies flying all around me,
Okay, so you feel like they really help
trying to,
you.
yeah, talk to me, trying to serve me, trying to massage me,
Mhm.
trying to be there for me in every possible way. So
Right.
I'm really, 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 really lucky. Yes.
That's wonderful. That's
Yeah.
so nice. You're lucky in that
And when I
factor.
feel good, I'm able to do things with them. We go
Oh,
out to
nice.
restaurants, we
Mhm.
eat,
So
we
good you stay
walk, we
active.
chat. Yeah, we do
Wonderful.
everything. We go shopping.
Oh,
They
that's
love
wonderful.
that part the most.
I'm sure you enjoy it as well.
Very much.
That's wonderful. So, let's see. So you've been diagnosed now for about 7 or 8 months. Is that right?
Yeah, about 6 months.
About 6 months. So you have a little bit left over of your treatment then.
Yes, yes.
Okay. And so, what do you, what are some of the problems that you might be dealing with now that you think are
Well,
things
sometimes
you might
there's
need
the
help
fear
with?
of, sometimes there's a fear of cancer coming back.
Of
Sometimes
course.
there's a fear of my husband is not as patient with me.
Mhm.
Um, so I have those fears.
Mhm.
Sometimes I have the fear of having to go back to work, which I really don't want to.
Mhm. So you used to work and you don't want to have to go back.
No, my work was very stressful.
What
And
did you do?
I was a children's social worker at the
Oh.
court system at dependency court. So I
Wow.
dealt
Yeah.
with all abuse and neglect cases,
It's a
basically
really big
just in court.
responsibility.
It was, and it's very stressful because there a lot of the times I was left alone. It was only me
Mhm.
reading all the reports, making all the corrections, answering the
Mhm.
phone, dealing with the attorneys, dealing with the judge's requests,
Wow.
and taking down all the orders, calling out on all the orders. There
Mhm.
was just a lot of responsibility
Right.
all
So
at
you were
once.
doing a lot at one time. So that must have been stressful for you.
Yeah, yeah. And
Yeah.
I think a lot of my cancer had to do with the stress in my life because they said that it was not genetic
Okay.
and I eat very healthy. I've never
Mhm.
eat meat. I don't eat junk food.
So you
I
don't
don't
eat
eat
many
a
of the
lot of
things that
sugar.
they would assess as being risk
No,
factors.
no.
That's
So I
okay.
think it
Sometimes you
was
can't look at
stress.
it as a causal relationship all the time.
Yeah. I mean, I don't know exactly the reason why, but I think stress was a big factor in my life that changed my life. And I think this
Mhm.
is a chance for me to just look back and think that I need to take care of myself more than anything else.
That's good. That's wonderful that you can actually come to that conclusion on your own and
Yeah.
not look at this solely as maybe an end to the situation.
Yeah, I can easily say that it was with the help of my family.
That's wonderful.
Otherwise, I couldn't have done this
Mhm.
at all.
Mhm. So do you feel like that stress that you were experiencing before has now been replaced by something else, or the stress has decreased? How are you
Well,
feeling in your
the
levels of
stress has really
worry?
decreased, and it's interesting. Even though I'm really scared of cancer,
Mhm.
but I feel free. I feel free for the first time that I wake up and I can enjoy the sunshine where
Mhm.
before I didn't even see the sunshine.
This made you just slow down.
Yeah. I don't have to rush to get ready to go get caught in traffic. Right now I have time to spend on myself. Like
How
I
wonderful.
do yoga.
Oh,
I
that's
spend
great.
time with my friends. I read my books. I have an easy paced life. I cook when I can. Even though half of the time physically I'm like a lump.
Really disabled,
Yeah.
I'm sure.
But the times that I do feel good, I really feel good. I feel good about my life. I feel lucky. I feel blessed.
That's wonderful that you can see that. Can you walk me through a little bit of what those physical ailments are that you're dealing with? So I can get an understanding of what you're dealing with physically.
A lot of nausea and a lot of weakness.
That happens often.
Yeah, body ache, joint pains.
And how would you rate that on a scale of 1 to 10?
When I feel bad, it's 10.
It's a 10.
Like,
you feel really
like
down.
6 days out of the week, it's between 7 to 10. And the rest of the time, it sort of diminishes. I have neuropathy, so I can't walk. I feel like I'm gonna
Which is a
fall
result of the
sometime.
chemotherapy.
Yeah.
Right. So have they told you different things that you could do to maybe help? Do you take your medications on time?
Yeah, I mean, they've told me to take vitamin B6, they've told me to take glutamine, and I try to take them as best as I can.
Okay, that's wonderful. That's
when
wonderful.
I'm nauseous, it's hard to take any of them, but when I'm not nauseous, I take them all.
Okay. So, I guess to develop on that, how is your eating, your sleeping? I'm sure it's affected.
The first few days, I don't have much appetite. But
few days as in few days after chemo.
Right.
Right.
But then afterwards, I'm fine. I can eat. And I have heartburn, but I have medication for my heartburn. So.
Okay, so you can eat your 3 meals a day. You're eating a stable amount of food.
Yeah. Thank God I haven't lost any weight.
Okay, that's
Initially I did, but then, I pressured myself to eat well.
So you're at your stable weight right now.
I'm at my stable weight.
That's good.
Yeah.
That's good. That's good to hear. So
I don't have vomiting. That's partially why. I mean, I have a lot of nausea, but no vomiting.
But no vomiting. Wow, you're lucky in that sense.
Yeah.
That's nice. So what about
for somebody
sleeping?
who's going through chemo, I have a fairly okay appetite. So.
Oh, that's good that you can recognize that. That's nice that you can recognize that. So your sleep hasn't been affected that much.
Well, initially it was very much.
Okay.
Because I was on this other drug that they had to take me off of it because it had very bad side effects.
Oh, wow.
And one of the side effects was that I couldn't sleep. It kept me awake and it gave me a lot of hot flashes. I still get the hot flashes with this other drug, but it's not as bad. Yeah.
Okay, so when they took you off that medication, did they explain if that would be okay?
Well,
they just changed your treatment plan a little bit.
Yeah. Well, what happened was I was on both drugs from the beginning.
When you say both drugs, you mean like specific to your cancer, the two types?
Yes.
Okay.
And one of them had much severe side effects than the other.
Okay.
So they figured after the fourth session, that the side effects could be a lifetime.
Oh, wow.
So they took me off.
Side effects in relation to specific ones? Like?
Yeah, like neuropathy, like my legs feeling numb, pins and needles in my legs and in my hands.
Right.
I would drop things from my hands. So after I stopped that drug, I felt better because that drug made my jaws cling. I couldn't eat or drink anything cold at all.
Lots of physical ailment side effects that you were dealing with.
My legs were totally numb. So it was a lot of bad side effects. And not being able to sleep.
And now you're off of that though.
Yeah, but this other drug also has its own side effects. The nausea is still there. The diarrhea is there once in a while. I feel joint pains. When my skin is peeling and my hands are getting dark. My hands and feet are peeling and getting dark. I'm losing hair, but I don't feel as sick as I did before. Yeah.
Okay, so that's nice. So it's become a tad bit more manageable for you.
Yes, yes.
Okay, well, that's good that you can recognize that also.
Yes.
So, can you maybe walk me through a little bit of how your relationship is with your husband? How long have you guys been married?
Well, we've
How
been
old
married
are
too
your
long.
children?
We've been married too long. We've been married for 31 years. My kids are 25 and 23.
And you
We've
enjoy.
had an okay relationship. I mean, we've never had serious issues like cheating or leaving each other, nothing like that. But we have very different types of
Okay.
we have different types of ideas, and our communication is not best sometimes.
Okay, so you have a little bit of clash because
Yeah,
not as good
especially
communication.
since I've got sick, he's so afraid that he's hiding it so much that he would prefer not discussing things with me. And
Okay,
that
so
sort
that's
of
like his mechanism.
frustrates me. I think, yeah, that's his mechanism of dealing with the situation. But for me, it's like he's ignoring me. So that has been sort of hurtful. I've tried to talk to him about it. Maybe I can bring him in on a session of
Okay,
therapy.
yeah, that's something we could try and work on later. If that is something that's hurtful for you and that's something you want to work on, then absolutely we can figure out a time and a place where you feel comfortable and he'll feel comfortable to come in here and we can go over some stuff if you'd like.
Yeah, I'm thinking about that.
Okay, that would
We'll
be
see how
nice.
things go.
That's good that you didn't really have any major serious problems with him, so I assume that he's been very supportive.
He
As
was
of
very
now.
supportive.
Okay,
Yeah,
that's
he's been
good.
very supportive. He goes to his cycles though, because he can't handle too much all at once.
Oh right.
So
Okay.
he needs a break from time to time, which is good. When my kids come, he gets a break. But at other times, he's been helpful. He's been very understanding, and I'm blessed, that I don't have to work. I can count on him. It would have been very hard for me if I had to go to work. I cannot imagine what it would be like.
Right. So, for how many years have you been working? If you could walk me through your work history a little bit.
I'm in the field. I've been working for over 18 years.
Oh wow.
Because before I had my kids, I used to work. But then I've been working 18 years after I've had my children. But 15 years working with only abused and neglected children in the court system. So all around, I've been in the same field. I loved working with children and especially with adolescent children.
Okay, so you enjoyed your
Yeah.
job for what it was,
Oh,
apart
I
from the
did.
major stresses that came with it.
Absolutely.
That's
But-
nice. That's nice.
But the stress sometimes it was just overwhelming.
Right.
And it had its own negative effects without me realizing it. All the issues that we dealt with are very sad and
I can imagine it takes a toll.
a lot of violence, a lot of sadness, a lot of bitterness. So it takes a toll on a person when you deal with it day in and day out.
How do you think that affected you specifically when you say take a toll? Can you explain a little bit?
I became like a machine. I just did what I had to do without even realizing that life has other beauties in it, and it's hard to explain. I don't know how to explain it really. But I felt like a machine, just getting up, going to work, coming home, just like everything was in order, without really realizing that there's a beauty in life by being spontaneous, by looking, sorry, looking at greatness of life. I just did what I had to do, and that was about it. I didn't have a chance to really think of the future, of how things can be more beautiful around me.
There was a lot going on with work and raising your children.
Right.
Yeah, that's hard. That's nice that you've been able to slow down a little bit.
Yeah.
That's good.
So now, yeah, exactly. Now I'm not like a machine anymore.
Mhm.
I can do things that I like, I enjoy at
That's
my own
wonderful.
pace of time,
Mhm.
enjoy my children more for
Mhm.
what they are, for who
Mhm.
they are, my husband, my family,
Mhm.
nature, everything in general.
So, are there things that you're worrying about currently? You sound to be that you're at like a pretty good, stable place. You've come to terms.
Yeah, I've come to terms with a lot of things in life. Having cancer also gave me a different view of life.
Mhm.
Every day I get up and I think, what if I'm not here tomorrow? What would I like to do today? And that's how I deal with it.
Good. That's nice. Good. Good. So
And
when did?
talking to you makes me feel good too.
Oh, good. I'm glad. So let's go through a little bit of your history. You've never dealt with any other major medical issues, any drug abuse in your past?
Oh no,
No. So no major illnesses other than this previously.
no. I mean, I've had my share of problems because I was always weak. I was not overweight, but I always ate healthy.
Mhm.
I had sinusitis for a long time that was
Mhm.
bothersome
Oh yeah,
for a
that's
while.
frustrating.
Yeah, and I've had my digestive problems, but nothing of a serious
Mhm.
form.
Mhm.
From time to time, I mean, I had to watch. I can't eat greasy food. I
Mhm.
never did eat greasy food, stuff like that. But otherwise, no.
Mhm.
I've been healthy in general.
Okay, so right now with this stress, you don't find any like current worries that you're dealing with that you think are
No,
overbearing.
I just hope my life remains the way it is.
Mhm.
That my kids will be happy and healthy and well. That
Mhm.
my husband is healthy and well.
Mhm.
I do worry about my husband smoking and drinking sometimes, overdoing it.
Mhm.
But that's the only stressor in my life that I worry about him.
Mhm.
My kids are doing very good, and I'm really happy about it. My family is very good. I have good
Mhm.
friends. No, I really
That's
don't
good.
have much
So
worries
do you
like
have a
that.
large family? You had mentioned your
Yeah,
support system.
I have three beautiful brothers, and I have a
Mhm.
father.
Mhm.
I have a cousin that I'm very close to. I have an aunt who takes good care of me. And, I have my nieces and nephews. They bring a lot of love.
Oh, that's nice.
Yeah.
That's nice. So your mother, you mentioned your father, but you didn't mention your
Yeah,
mother.
my mother passed away when she was very young.
Okay, so you must have
This
been
was,
young also.
yeah, I was only 21 years old when she passed away. So
Sorry to
that's
hear that.
28, 29 years ago. Yeah.
Wow.
Yeah, she passed away a long time ago, almost 30 years ago.
Oh, wow. So, when did you exactly come to the U.S.?
I was only 15.
Mm-hmm.
I went to boarding school and I was in
For a long
Massachusetts for
time.
2 years.
Mm-hmm.
And then I came to college to California. And that's where I
Okay.
met my husband.
Okay.
My younger brother, who was 2 years old, younger than me, came 2 years after I did.
Mm-hmm.
Then I became his guardian, basically, his legal guardian.
Okay.
And my two other brothers came about 5, 6 years after that.
Okay.
So my
And
older brother and I lived together with my husband, with friends, basically. Our college friends became our family because none of
right.
us had our family here
Most of
together.
your family was still back.
Yeah, back in Iran because of the Iranian Revolution. Excuse me, I've got to put my jacket on.
That's alright.
My parents couldn't leave the country, and neither could any of the other Iranians.
Wow. So the revolution must have been a really stressful time in your past.
Oh, sure, yeah, it was.
Mm-hmm.
I basically raised myself and raised my brothers, and then when my mom died, my father and my grandparents came over, so I literally became their parent too.
Wow, that's a huge
Yeah,
responsibility.
yeah, it was.
So you've always played such a caretaker role.
Yeah, I mean, that's life. Indeed.
Mm-hmm.
One has to go on with what life brings us.
When you look back on that, how do you feel about it?
I always felt a big responsibility taker. I always felt like my role in life has been to give. I'm a giver, and I
Okay.
enjoyed it.
Okay.
But ever since I got sick, I felt like now I need to get love from other people, which I did. Thank God. I guess I made enough impression in other people's lives that
Mm-hmm.
is coming back to me.
That's wonderful.
Yeah.
That's wonderful. So I'm sure that a lot of your stress has then decreased now in the sense that you aren't taking care of as many people per se and
Yeah, well, after having my kids and my brothers got married, my grandmother passed away, so I was basically just responsible for my kids and my husband.
yeah.
Excuse me.
Mhm.
I haven't worried about anybody else as much.
Mhm.
But like I said, the stressors of work itself and running and coming and taking care
Mhm.
of the daily responsibility was sometimes overbearing.
Oh my god, I'm gonna shoot myself.
What
Mhm.
happened?
Oh, it's still recording. Okay, whoops. Okay, yeah, I could understand.
Yeah. But thank God, I don't have those kinds of stressors because my kids are very good, responsible kids.
Okay.
Now, my husband's work is more stable because
Mhm.
we've had a lot of financial instability in the past.
Oh, mhm. That must have been hard.
Yeah. So, yeah, it was a mixture of everything. Yeah. We've had a lot of unstable financial situations in the past. But because I was working, we could always count on my salary. Now my husband tells me that I don't need to worry about it, so I'm not going to worry about it.
Okay, that's good. So we can maybe talk about that another time so we don't need to bring it up
Yeah.
completely at this moment. So, if you are having some sort of worries, I'm sure in the beginning, when you were dealing with your diagnosis and so on, I guess trying to understand how do you feel like you've grown? What would you like to see out of our therapeutic relationship? Are there things that you think I could help you with apart from what you had explained with your husband, maybe improving that
Yeah,
communication?
basically just the stressors of life, as
Mm-hmm. You just
for
need some
somebody who's
support.
walking on eggshells, knowing that I have cancer.
Mm-hmm.
I have my days where I get very sad and I think that I may not be here tomorrow.
Mm-hmm.
But these are stuff that I couldn't discuss with my family members. I can discuss with somebody who's not necessarily a part of my life.
Right, right.
Yeah.
And I could be here for you to do that. For when you do need it. So we can decide what kind of plan that you want to follow. If you want to start off with maybe once a week, twice a week, whatever would work for you.
I
Because I
think
know
once
you
a week
said
is good, yeah.
once a week. Okay, so we can keep aware of your chemotherapy schedule and how your physical ailments are doing. I did just have a little bit, couple of questions otherwise to get an idea of what your the work that you talked about in your educational background and just how you feel now that you're not working and since you did work for
Sometimes
so long.
I do miss the fact that I was on a schedule of trying to help people and I had
Mm-hmm.
friends at work. I miss that portion of it, but I really don't miss the stress factor.
Okay, so as of now,
Yeah,
that's
and
not.
right now I'm just trying to deal with my physical because there are a lot of days that I don't even have energy to get out of bed. I
Mm-hmm.
can't imagine if I had to go to work how much I had to pressure myself. I would have been calling in sick.
Oh yeah,
Yeah,
often enough. That's
yeah,
understandable. That's understandable for you to feel
yeah,
that way.
yeah,
So your physical ailments really do bring you down a lot, and
yeah.
I'm sure that takes a toll on how you just feel altogether. So do you
Yeah.
feel like you're able to bring yourself to do the things you still want to do? You had explained that you are active.
Sometimes I'm not, no.
Mm-hmm.
Sometimes, like a lot of the days, I just want to go and walk about and cook and go walking and go places. But when I do, I get up in the morning and I have that notion and I do it. By 2 o'clock in the afternoon, I just want to pass out.
You don't have the
So
same
I
level
don't
of
have the
energies.
same
Yeah.
level of energy.
How
And
does
I have
that?
to come in terms with that myself.
So in that process of coming to terms with it, what do you feel when you say you have to come to terms with that?
Initially, I got really sad and I said, why do I have to go through this? Why do I have to feel like an 80-year-old woman at age 50? But then I accepted that this is only a short period of my time and it's not going to be so all the time. I have to be realistic. And I've come in terms with it.
Okay, so the days that you do feel like you don't have energy and so on, you don't get that sadness that comes anymore.
Yeah.
Is that what I'm understanding? Okay.
Yeah, that's what it is. Correct.
That's nice. Okay, so that's good. You've been
Thank
able.
you for understanding. You seem like you're right on the path of what I'm thinking. You totally dig me.
Well, you're a good communicator. I'm trying to communicate well with you. Hopefully, we can keep this up. You need some support, and that's what I'm here for. I'm here to support you. I'm here to help you. With whatever you feel like you may be having difficulty with that week, let it be something minuscule or something that you think is much bigger that you want to talk about.
Okay, I'll give you a call.
Okay, so we can set up the meetings for
next week, maybe.
Okay, for next week. That sounds good. Let me check my schedule really fast and let's see if there's something that we have. Something else. Okay, I can do Tuesday at 5 if that works for you.
Next Tuesday?
Yes.
Yeah, that's fine.
Okay, wonderful. Before you go, I just want to ask you just a couple of quick questions about your childhood, since we hadn't really gone over that. If you don't mind, we still have a little bit of time left of the hour.
Well, I was the first child in my family, and I have 3 younger brothers. I had a very good childhood. My grandparents, my maternal grandparents, had a big role in my life.
Oh, that's wonderful. Where did you grow up exactly?
I grew up in Tehran, Iran. I went to French school, so I learned several languages at once. It was a very difficult school, so academically it was very hard. But otherwise, I had very good friends. I had a good childhood. My parents were very loving parents.
Okay, that's wonderful.
They had some issues between my father and my mother. Had some issues between themselves.
Okay.
But that did not affect us in a way that they would give us less attention.
Okay, so you didn't feel like even the issues that you were aware of, they didn't affect you?
No.
They didn't make you upset?
They were just arguments about disagreements.
Oh, okay, so nothing very serious.
Nothing very serious.
So you got along well with your 3 brothers growing up?
Very much. I'm closest to my oldest brother, but I'm really close to the other 2 as well. They look at me as their mother now, since my mom left.
Since your mom passed away so young.
But we always had a good relationship. They're very loving. And I had a good childhood, I don't have much to complain for my childhood. I really don't.
That's nice.
But all of a sudden I became an adult at age 15 rather than age 18.
When you were sent to America, is that right?
So I basically made my own decisions.
Forced maturity on you.
Yeah.
Yeah, that's understandable.
So that was tough, being away from my parents at a young age. But otherwise, everything else was very natural and normal.
Okay, so that's nice. Did your mother have easy pregnancy, any birth complications?
No, I don't think so. She had all 4 natural childbirth.
Okay, and with you specifically.
Oh, with me, yeah, I actually she did. She had a premature labor, so I was a
Oh, she
premature
did.
child. I was
Okay.
born 7 months because she had a fall,
Oh, she had a fall, which caused.
which caused the early delivery.
Oh, wow.
Yeah,
Wow, that. And you feel like you recuperated well from that.
I hope I did.
Yeah.
I'm not retarded.
Was that difficult for your mother and your father that they're firstborn?
Well, my mother talked about it. My dad never talked about it. But my mom said that she was really scared that she would lose me. And thankfully, I was a tough cookie.
Oh, good. That's
She
wonderful.
didn't lose me. I'm here.
Yeah, and you're fighting through this difficult time now
Yeah.
in your life.
Yeah.
That's good. That's good. So you had mentioned that you are active in some activities like yoga, and what other activities do you try and keep yourself busy with?
I didn't mention that to you, but yes, I am.
Oh, I thought you did.
Yeah, I'm involved in yoga. I love my yoga classes. I also go to acupuncturist.
Oh, okay. What does the acupuncturist help you with?
With my neuropathy and basically my stress as well.
Oh, that's wonderful.
Yeah, so that's why I'm not as stressed, and yoga really helps me with all of that.
Okay.
I try to go to yoga 3 times a week, but on the week that I get chemo, 2 days I don't go. I only go one day.
Right, because it's hard for you to have the energy to go.
Correct.
Okay, that's
I'm going to be going for the following week, 3 days in a row.
Oh, that's good. That's good. So you really enjoy your yoga.
Yes.
Are you keeping yourself mentally stimulated?
I read a lot.
You're still able to read a lot?
When I can. Well, when I can. A lot of the times. Sorry.
That's all right.
I get tired like right now and I fall asleep. But there are times that I'm able, to read like 50 pages all at once.
Well, that's good. Okay, so you know that it's important for you to try and keep yourself mentally stimulated at such a time, and maybe read things that aren't related to the struggles that you feel like you're facing right now.
Oh, absolutely. I try to watch movies that are happy ending, like funny movies, or read books that are inspiring, spiritually inspiring.
Oh, wonderful.
Like I also do a lot of spiritual meditation.
That's nice. Could you explain what it is that exactly you're doing?
Sorry.
Geez.
It's the breathing that I do. I try to, excuse me. I try to breathe, to release stress.
Is this breathing that you learned through some meditation course?
Yes. No, through a friend of mine who's a healer.
Oh, okay. And how often do you partake in that? I
try to do it once a day.
Oh, that's wonderful.
Yeah.
So when you're feeling poorly, are you still able to do that? Or
no, I'm not. That's when I don't, because I pass out.
Yeah, it's hard to muster up the energy to do that, I imagine.
I just hope once this chemo is over that I get my normal energy back. That's the only thing I'm hoping for. But they've said that my neuropathy may last a while, so I may not have the same energy as usual. And I will have the tiredness for quite a while.
Right, so you are doing what you can in relation to the neuropathy. You mentioned acupuncture, yoga. You mentioned some vitamins that you take. So I'm sure if you keep up with those things and you give your own body the tools that it needs to recuperate, you should recuperate in time.
Absolutely.
You have to just be patient with yourself.
That's what I'm hoping. Yes.
Do you find that patience right now for you, is that hard? Is that an easy thing to achieve?
Sometimes I'm not patient enough. Yeah.
Right. So maybe that's something you would want to work on.
Yeah. Maybe you can give me tools.
Sure, of course.
Once we elaborate on my issues, daily issues.
So you find that most of your issues are just daily issues that you're dealing with?
Yeah.
So you don't have major worry?
No, my only worry is be able to get through chemo.
Right, which you seem to
be
be
able
doing.
to get rid of cancer,
Mhm.
and to have a better relationship with my husband,
Mhm. Mhm.
and just help my children get through this hard time too, because they went through a bad time.
Mhm.
know
I
they
can
feel better.
imagine. Mhm. So these are the things that just heal with time, and I'll be here to help you walk through it. And you explain that you have a great support system with you, so we're all here together. So you've never had a past of any major depression or
I
depressive
don't think so.
symptoms.
Initially, before I was diagnosed, I was tired for a long time, and
Tired
people
as
thought
in,
that
can you
like I
explain?
didn't have any energy.
Okay,
My
so
energy
physically you
level,
just felt
physically,
very
yeah.
tired.
And I didn't have the energy to enjoy things that were
Enjoyable for you.
enjoyable,
Mhm.
right? And people around me thought that I was depressed, but I wasn't. I knew
How
that I
often
wasn't.
how often would this happen, and what makes you say that?
Just that on a daily basis, I didn't have enough energy. I was
Mhm.
fatigued all the time.
So you were fatigued all the time. Mhm. So the people around you were thinking that maybe you were dealing with some issues of depression,
Yeah,
and
they thought it was emotional rather than physical, but it wasn't. It was all physical.
what led you to believe that it was? You say it was such certainty. Is it because of the cancer that now you know you feel that way, or at the time
No, at the time
you?
I knew I was fatigued in an abnormal way, but I
Mm.
didn't know the reason why.
Oh, I see what you mean. I see what you mean.
Yeah,
So this fatigue that you had obviously made work very hard for you.
absolutely.
And did it ever make you really sad that you were very fatigued? Were you
Yeah,
able to
of course
sleep
it made me
still?
sad. Yeah, my sleep pattern was not good. It had changed a lot.
Mhm.
And I felt like I'm not my normal self, of
Mhm.
course. And that made me sad.
Of course.
But it wasn't like because I was emotionally depressed. It had
Okay, so
nothing
you
to
didn't
do
feel
with
like
that.
there was a specific
There was
emotional
no,
trigger.
right, there was no cause and effect necessarily in that sense.
Sometimes it's just dealing with all these things at one time. They all kind of get muddled together, and it's hard to decide what's causing what, but it's,
Could be, yeah.
you know, so interesting. Okay. So now the fatigue that you feel, is more related to chemo, and the days that you're feeling better, your fatigue isn't as high,
Yes.
right?
Yes,
So you
correct.
said you're able to do the activities you want to do,
Correct.
not to an extreme extent,
Correct.
but that's good. Okay, that's wonderful. So it was very nice to meet you, Jacqueline.
Thank you.
I'm very happy we were able to talk. I hope you feel comfortable with the situation. I hope you would feel comfortable to come and see me again.
Absolutely.
Wonderful.
With pleasure.
Okay, so
Yes.
we'll do next Tuesday as of now, but
Yes.
I do want you to know that if you're not feeling well, if you don't think you can make it over here, just try and call me earlier in the day, or, we can always reschedule. Right now my schedule is pretty open.
Okay.
So if another day
Should be
works better
fine.
for you, just let me know.
I should be fine next Tuesday for
Okay.
sure.
So you felt comfortable with our talk?
Absolutely.
Okay, I'm very glad. Is there anything else you wanted to mention just for
No,
today?
thank you for listening to me.
Absolutely.
You're a very good listener.
Absolutely. Thank you.
And I enjoyed talking to you.
As did I. You were very,
I felt very
explanatory. That's good. Good. So did I. Thank you.
Thank you.
Mhm.
Thank you.